Stand by.
Let's do next. Please.
Good afternoon, everyone watching us on WHO Twitter account, dialing in by phone and watching us online for a regular press conference regarding coronavirus disease, COVID-19. With us, we have Dr. Tedros, WHO Director General. We have today Dr. Janet Diaz, who is the Head of Clinical Care within WHO Emergency Program. We have also Dr. Jawad Mahjour, who is Assistant Director General for Emergency Preparedness, and Dr. Oliver Morgan, that you had opportunity to speak with, who is Director of Health Emergency Information and Risk Assessment. Journalists online, those who are dialing in, as most of previous days, it's *9, and you will be put in line for questions. Those watching online through Zoom, you click raise hand on the right-hand side of your screen, and you will be able to ask questions. We will have an audio file and transcript as always. I hope by now you know where to find those transcripts and audio files for your reference. I'll give the floor to Dr. Tedros.
Thank you, Tariq. And good afternoon, everyone. And let me begin, as always, with the latest numbers. As of 6 a.m. Geneva time this morning, China has reported 74,675 cases of COVID-19 to WHO, including 2,121 deaths. The data from China continue to show a decline in new confirmed cases. Once again, we are encouraged by this trend, but this is no time for complacency. Outside China, there are now 1,076 cases in 26 countries, with a total of 7 deaths. In the past 24 hours, the Islamic Republic of Iran has reported 5 cases, 2 of which have died. This is the first report from Iran. Of all cases outside China, more than half are among passengers on the Diamond Princess cruise ship. The first passengers have now disembarked, providing they have a negative test, no symptoms, and no contact with a confirmed case in the past 14 days. Japan has also advised passengers to stay at home for a further 14 days and monitor their temperature. And also, Japan has set up a hotline for passengers to call if they have concerns. Japan is in regular contact with other countries through a mechanism set up under the international health regulations, so those countries can follow up with their nationals who were passengers on the ship. In addition to monitoring the evolution of the outbreak, WHO's main role is to work with countries and partners to coordinate the global response. We're doing that in several ways, both internally and externally. As you know, a WHO-led international team of experts is now on the ground in China, working with their Chinese counterparts to find answers to some of the things we don't know, including the transmissibility of the virus and the impact of the measures that China has taken. The team has been brought together through the Global Outbreak Alert and Response Network and includes experts in epidemiology, virology, clinical management, outbreak control, and public health from the following institutions: the National University of Singapore, the St. Petersburg Pasteur Institute, the National Institute of Infectious Diseases Japan, the Seoul National University College of Medicine Korea, the Nigeria Center for Disease Control, the U.S. Center for Disease Prevention and Control, the U.S. National Institute of Health, the Russian National Medical Research Center of Pulmonology and Infectious Diseases, and the Robert Koch Institute of Germany. Let me describe some of the many other ways WHO is coordinating the response. As you know, global coordination is key in fighting a dangerous enemy like this coronavirus. We have convened the WHO Health Security Council, a daily meeting of myself, our Chief Emergency, Dr. Mike Ryan, the regional directors, and other senior staff to review the evolution of the outbreak and coordinate the response. Yesterday, we held the first of what will be weekly briefings with diplomatic missions here in Geneva to keep our member states informed, and we're holding these daily news briefings to keep the media informed. Yesterday we couldn't have the press conference because we had dedicated it to a briefing to the member states. I also hold a weekly call with a range of independent experts from around the world representing all regions, very senior experts as a complement to the advice provided by the emergency committee. And 2 weeks ago, I briefed the UN Secretary General, Antonio Guterres, and we agreed to activate the United Nations Crisis Management Team, led by Dr. Mike Ryan. Today, we're holding a second call with UN country representatives to brief them on the measures they can take at country level to coordinate the UN response. Because what matters is the intervention or the actions we take at the country level. And that's why we involve all UN resident coordinators and WHO representatives at country level. Twice a week we have a call with clinical experts who are treating patients with COVID-19, including frontline workers in China, to share information about the progression of disease and what works and what doesn't in treatment. We have also set up an online platform where clinicians can share anonymized patient data so we can build a clearer picture of the disease. What we're seeing is that the earlier patients are tested and treated, the better they do. We're also looking forward to results from 2 clinical trials of therapeutics prioritized by the WHO R&D, the Research and Development Blueprint. Our one combines 2 drugs for HIV, lopinavir and ritonavir, and the other is testing antiviral called remdesivir. We expect preliminary results in 3 weeks on these therapeutics drugs. My colleague Janet Diaz is here to answer questions about the clinical management of patients, because even if people are infected, having a better outcome, saving their lives is really key, and that's what we're also investing on the therapeutics and patient management. And I have written to 12 chief executive of manufacturers of personal protective equipment to seek their cooperation to ensure supply to protect health workers. And there is a good signal, positive signal from the manufacturers. This is, as I always say, a time for solidarity. Governments, private sector, civil society, and the whole world should stand in unison. Today, we had a call with faith-based organizations as another way of reaching communities with messages to prevent infection. We're partnering with Africa CDC to coordinate our efforts to prepare African countries for the potential arrival of the virus. That's where we believe, in Africa and other continents where we have weaker health systems, the virus could be a serious danger, and that's why we're focusing in continents and countries where the health system is weaker. You will get sick of me saying that the window of opportunity remains open for us to contain this outbreak. WHO is doing everything we can to seize that the window of opportunity, and we urge the international community to do the same. And as I said before, let's not squander the window of opportunity we have. The number of cases in the rest of the world is very small compared to what we have in China. But that may not stay the same for long. The window of opportunity we have now may close. So we need to use the window of opportunity we have now by hammering the outbreak in any country. Thank you so much.
Thank you so much, Dr. Tedros. Before we start taking questions, to remind those dialing in to press star 9 to ask a question. Those who are joining through Zoom online to click raise hand. We will start with the questions here in the room. I'll start with Eloy, please.
Hello, you for IFP TV. Could you say a word about the decision about the Russian authorities to stop the entries of Chinese citizens, and maybe a word also on the cured people? How many are they? And how many? Which one? The cured people, the people who are recovering from the virus. Thanks.
Okay. Would you like to say? Okay. Yeah.
No, about the travel restriction. As you know, we are monitoring the travel restriction through several channels. The first one is what is reported in the media, and we verify it with the member states. Under the HR, the member state report to us the travel measures they are taking, and we also look at the justification and come back to them. And we are also in contact with ICAO, IATA, IMO, who are providing us with information. And with all this information, our role as WHO under HR to verify anything information with the countries and to report. So far, 30 countries reported to us officially that they are taking some kind of travel measures. And we ask them for justification, and we publish the justification through the IHR network to all state parties to take note of them and to also have a look to justification. This information is available, and in this context we are dealing with any information we have, including the one that you spoke about.
Thank you. There was another question about recovered discharge.
So, good afternoon. Thank you. I actually don't have the exact number of the discharged patients. I'm looking at Oliver to see if, do you have that exact number?
We'll get back.
But I could say we do know patients are being discharged. From the information we had, the largest study from the Chinese CDC published that about 81% had mild disease. We know that about 15% have been reported to have severe disease in that largest cohort, and about 5% critically ill. So we do know that the patients are being discharged, and including those patients outside of China as well being discharged in good condition.
Thank you. Jamie, and then we may go online. Jamie, please. If you can get to the microphone, please.
Yeah. I'm Jamie, Associated Press.
There's been a request from South Korean authorities to limit the number of people in the city of Daegu, I believe, to recommending that they all stay home and wear masks after reporting new cases there. I'm just wondering how concerned you might be that signals an escalation of the risk to countries outside of China and beyond the epicenter. Thank you.
Yes, thank you very much for the question. The number of cases in South Korea reported today are actually from several distinct clusters. which the Korean authorities are following very closely. So although the number seems quite high, they are mostly linked to known existing outbreaks. So that hasn't changed, and it doesn't signal a particular change in the global epidemiology, but it does signal that the Korean authorities are following up very closely, very vigorously on all the new cases and those outbreaks that they've identified.
And maybe adding to that, I mean, the total number of cases Korea has so far reported is 104. And Korea reported 22 cases today. And with measures they can take, which is proportional to the public health risk they have, I think the number of cases are really manageable. And I hope South Korea will do everything to contain this outbreak at this early stage. Thank you.
Thank you very much. Let's go a little bit online for those who are following us either through phone or watching us. Do we have someone from Africa Czech? Can you please introduce yourself?
Yes, I do. Hi, my name is Ayo. Hi, my name is Ayo. I work with Africa Czech. I would want to find out if chloroquine, which is an anti-malaria drug, is effective in the treatment of coronavirus. Thank you.
Thank you very much.
Thank you. Thank you for that question. So at this moment in time, there is no proven effective treatment for COVID-19. And so that is clear at this moment in time. However, there are ongoing clinical trials being done in China at this moment as well. The two that we've already discussed are testing the priority therapeutics that was prioritized by the WHO R&D blueprints, and that includes lopinavir and ritonavir as well as remdesivir. Now, for chloroquine, there is no proof that is an effective treatment at this time. We recommend that therapeutics be tested under ethically approved clinical trials to show efficacy and safety. Thank you.
Let's go to a few questions. CGTN first, then one question here. Please go ahead. Introduce yourself because you are new to us.
There's a little button. That one, yeah, that one. Perfect. Okay, Guy from CGTN, hello. I just wondered, having observed the actions taken on board the Diamond Princess, from observing them, is it your observation that those actions were always primarily designed to keep the infection rate as low as possible on board, or was it equally, possibly even more, about ensuring that the infection rate was kept down off the ship on the mainland?
Your question, please. I didn't get to the question. Sorry.
I was just asking about the actions taken on board the cruise ship, and whether you observing approach taken, whether your observation was primarily designed to keep the infection rate as low as possible on board, whether it was as much designed to keep it as low as possible on the main, to sort of keep it on the ship without it spreading to the main.
Our understanding is the action by the Japanese health authority is to prevent or to contain the outbreak on the ship first, because they were heavily detecting cases and taking the positive cases to the mainland to be treated in adequate hospitals. I think their objective is to contain it within the ship, not to prevent introduction in the mainland. I don't know if this is your question. This is why they were heavily following the contact, proceeding with analysis and checking symptoms to detect any case, and when the case is positive, they were taking it to the hospitals to be properly treated. The main objective of their operation, at least from our understanding, is to contain the disease or the virus within the ship.
So then if you follow the next steps they're taking, as I have suggested, as I have indicated earlier, their objective is to do both. In the ship you minimize, and then once they disembark also the same. So I think it's both. Thank you.
Very much. Can you please introduce yourself and then Shane?
So thank you. My name is Kayoko Geiji from Asahi Shimbun, Japanese daily newspaper. My question is related to previous question. So, two passengers of Diamond Princess have died, and several experts have questioned the effectiveness of the quarantine measures on the cruise ship. So last time, Dr. Ryan pointed out it would be very important to study to see what led the transmission on the ship. But what do we know so far in terms of
Can you speak louder?
So what do we know so far in terms of the infection control?
Sorry?
So far, what do we know about infection in terms of infection control? Some experts pointed out it's not taken appropriately. So, which is.
You want to speak about the debt? Anyway, I think, as I said, the main objective was to contain the disease, and they were practicing drastic measures of infection prevention and control, and also isolation of the cases to avoid close contact and to avoid opportunity of the transmission. And now they went to the second phase, where they are now allowing people who were respond to 3 criteria. The first one is having no symptoms. The second one is having a PCR or laboratory test negative, and third, that this person was not in contact with the positive cases for the last 14 days. They will allow them to go and to be self-isolated at home and to continue follow up in the temporary. This is what they are doing now.
Yeah. And on the people who have died, we have the report that they're 2 and more than 80 years old, and with some underlying disease conditions. And considering the number of cases, which is more than 600, and elsewhere, so far the observation is there is a fatality of 2%. And this is what we would really expect, which is very unfortunate, though. Having deaths from the number of people who have been in the ship, considering the fatality rate, I think has to be understood that way, and the underlying conditions of the people who were positive too.
Thank you. Shane, do you have a question?
Okay, so it's my turn?
Yes, please, and then John.
Shane from China Central Television CCTV. Question for Dr. Tedros. So, you already released the background of the experts for the international expert team.